This is the first edition of Goto Market Strategy for health analytics solutions providers. Rakesh Parimi, who is also known as Rick Parimi, in his professional circle, created this Goto Market Strategy primer originally for Oracle Corporation. This was presented to Oracle senior management in November of 2014. All material in this presentation is copyrighted by Rakesh Parimi. This presentation covers the following topics: the United States market opportunity for healthcare analytics solution providers, the United States healthcare market segmentation, strategic insights from the author of this presentation, healthcare demand drivers, specific activities that healthcare analytics solutions providers need to undertake in order to increase sales and marketing. About the author. If you are interested in seeking specific insights about strategic and tactical initiatives to increase market share, please contact the author using the contact information provided at the bottom of every slide. The United States healthcare market is broadly classified into enterprises, mid-market, and small and medium size. Currently, hospitals are at the center of health analytics in the United States. This trend will change over time, as the industry gets partly decentralized and becomes more mature. On average, every hospital is making frugal investments in the space of healthcare analytics. There are some hospitals that are also making large bets on the intended value proposition of healthcare analytics. On the contrary, analytics solutions providers are seeking top-line revenue growth, which is partly inspired by the fact that healthcare analytics is likely to witness a 25% CAGR. In the healthcare domain, not even the best accountable care organization is profitable. There are 5,800 health systems in the United States, but the industry as a whole is losing 15% revenue on year to year. Healthcare institutions are, by and large, operating with a tendency to benchmark against the industry. This is a norm that has been witnessed in many other industries before. This is the norm of seeking operational efficiency from price sensitivity. This is a fundamentally flawed strategy. Unless driven by strategic positioning, neither a healthcare provider nor the healthcare analytics solutions provider will achieve differentiation. Differentiation only comes from innovation-sensitive approach. A good example is Kaiser Permanente. But the challenge that everyone is facing is being able to replicate the model to other institutions. Question is, can healthcare analytics solutions providers really help the healthcare institutions? If they can, then what is it that the solutions providers need to do and be aware of to help the healthcare institutions? This slide covers the United States healthcare market segmentation. Since there is plenty of literature on this topic online, this presentation shall not go into the details. Keynotes are recognizing the fact that the strategy for healthcare analytics solutions providers needs to be targeting focus clients for early customer validation. This is followed by penetrating the target market. It is also important to identify the target market very crisply. A key fallacy of every solution provider is either taking large bets on the target market or shortcoming with the strategy planning. Large healthcare institutions always provide good economic incentive, and so every solution provider tends to look at the big picture more often than required. Finally, do not choose Gartner Magic Quadrant as a point-in-time analysis. Rather, derive the trend of customer demand. What is the customer expecting today? How is this related to what the customer was expecting yesterday? What is the customer likely to expect tomorrow? Where are these demand drivers coming from? Speaking of strategy, it is important to identify strategy misalignments before exploring the demand drivers. Common pitfalls are: 1. Position, commoditized, marketing communication, infrastructure heavy, designed for it, mobile, SaaS not levered, not modular. Customer retention, SEM. Reinvestment mix, high or low. What is your ROIC to WACC spread? For IT firms, in 2000 the spread was 35%, on average. In recent years average this spread is down to 9%. What was your ROIC in 2014? This is a key indicator of how well your strategy is performing. The author recommends a study of your sales and marketing KPIs for the last 8 quarters, and do a trend analysis. While the author cannot give a specific prescription for your company, use a slide to create your strategy to increase marginal profit. This needs to be your immediate focus after identifying and resolving the strategy misalignments. What are your sales and marketing channels, and how are these effective? Look at cross-channel, B2B content marketing, social marketing, engagement data, customer experience, and strategic partnerships. How are these channels resulting in performance of the KPIs? Evaluate marketing attributed revenue, channel economics, B2B engagement, customer retention, customer advocates, offerings and margin trends. Bottom line is that you need to convert your strengths to achieve the desired outcomes. The desired outcomes depend on your specific business model, but can include products around business insights, mobile buy, but should also include establishing credibility in customer experience management. Now we are on one of the most interesting topics: healthcare demand drivers. We have all seen this infamous hype cycle from Gartner. But there is a fundamental flaw. The flaw is that everyone is following this blindly. The hype cycle is intended as a 30,000-foot level view of what is trending in this industry. Your strategy gurus need to tailor this for your business model, and to help you design and build products that will yield high economic value. Contact the author for further assistance. About the author: Rakesh Parimi, MS and BS in Computer Science, has nearly 2 decades of experience in multiple industries: banking and financial services, manufacturing and supply chain, telecommunications, and healthcare. Rakesh has consistently served F500 companies, and started career as a technologist with IBM and Oracle, having produced 7 software patents for IBM and couple publications, and in the recent few years has niche experience in healthcare, payer, PBMs, and provider. Rakesh's passion is strategy planning for revenue, P&L, increase and gaining market share, both short-term and long-term, with specific focus on business innovation. Rakesh particularly enjoys corporate strategy and discerning the competitive landscape in the healthcare industry, with special focus on M&A in healthcare. Rakesh is a member New York Academy of Sciences, and is pursuing MBA from NYU Stern, 2014-2015, General Management with specialization in finance, strategy, and product management. Rakesh attends conferences pertaining to healthcare strategy and business leaders or innovation forums. So, what is your strategy to increasing market share?